Greetings and welcome to Mental Health Trailblazers, Psychiatric Nurses Speak Up. I'm your host, Indrias Kassaye, and in this second episode of Season 3, exploring the mental health crisis affecting youth and adolescents in America, our focus is bullying. According to the U.S. Surgeon General, 1 in 5 high school students reported being bullied in school in the past year, and 1 in 6 reported being cyberbullied. These numbers reflect what is happening in the general population and rise significantly for students from ethnic or racial minorities and those who identify as LGBTQ. Extreme cases that result in suicide or violent retaliation sometimes make national headlines. Countless others fly under the radar, and for too many, the harmful consequences can last a lifetime. Guiding us through this exploration of the mental health impact of bullying, particularly for young people from marginalized communities and what nurses can do about it, is SAMHSA Minority Fellowship Program at the American Nurses Association alumna, Dr. Teresa Combs. Dr. Combs, welcome to Mental Health Trailblazers.
Well, thank you so much for having me.
Let me start by asking you how you got interested in bullying as a focus area for research and practice, and what that work has entailed.
So for me, it was actually from a job I had on this adolescent unit. It was on an inpatient unit, and they came in for severe anxiety or depression. During the group meetings, bullying was brought up a lot. The direction of the conversation from the people who were leading the group, they were directing it to, you feel this way because you've been bullied. But my thought was, well, what if they had symptoms of depression and anxiety prior to being a victim or being a bully? Because I also knew that children and most people who have severe depression or a lot of anxiety tend to not engage a lot successfully with other people, and other people don't particularly like to be around people who are depressed or anxious. And so I wondered if just having those symptoms made them more vulnerable to being bullied.
What happened next?
I decided to do the dissertation on it, and I used this model. It's called causal uncertainty. If a person understands the cause and there's nothing they can do about it, that they tend to be more resilient than people who just accept the cause, accept the bullying or the bad behavior, whatever the outcomes are, as part of who they are. So if you embrace the fact that you're all these names that you're being called and allow the bullying, you have a greater chance of having more severe mental illness later on in life than if you're being bullied because you're Black and you have a bald head. Then it's like there's nothing I can do about that. And
Right.
So it's easier to sort of resil yourself from that.
So how big a problem is bullying in this country?
It is much more common than it's reported because there's a lot of shame and stigma. Just like with mental illness, there's shame and stigma with being a victim. The most frequent type of bullying is direct bullying. And that's the physical bullying, where you're being shoved and kicked and pushed, things taken from them, that type of thing. And then the end of middle school to high school to about 10th grade, there's a lot of bullying, both direct, indirect, and indirect is relational. Relational bullying is being excluded from groups, rumors started on you, name calling, making fun of, those types of things. It really ramps up a lot. And in there comes cyberbullying, which cyberbullying is like relational bullying on steroids. It goes out into the cyberspace, and it's hard to go back.
Yeah, and it also allows the perpetrators a certain level of anonymity. And one of my questions for you was, you've seen this phenomenon, bullying in general. How has it changed?
Well, I should have started with the definition of bullying. Now,
Yes.
It's a variation of this, and that is, it is a consistent and intentional act of violence by a person or a group where there's a perceived or an actual imbalance of power.
Mm-hmm.
And so over time, you're right, back in the 50s, 60s, 70s, bullying was expected. But when there's a somewhat of an equal playing field for both people involved, it's not considered bullying. You need that power gradient. Someone is more powerful than the other one, or there's a perceived power for it to be bullying. It needs to be intentional. And And most of the time, the things we do when we're soft bullying other people, it is intentional. It can even be persistent. What separates it all is there a difference in power or a perceived difference in power for the victim? And so over time, it has increased in some ways and decreased in other ways. Now, for particularly in grade school and grammar school, there's a lot of work being done with children now about bullying. It has not stopped, but there is a lot of work by school counselors, teachers, having actually courses woven into their work that students do now that address bullying. So if you look at the younger people tend not to do it as much. The older people, it's exciting and fun, and it has escalated with cyberbullying. And there's this other concept of Machiavellianism that is a part of the whole bully experience. Machiavellianism is a personality trait where they'll use cunning, manipulation, just any means possible to meet their personal needs. And the other thing about Machiavellianism, and that doesn't end with age, and a lot of our CEOs of companies, they tend to be very effective if they start off, young, bullying, and having this belief that, everything I do, I'm going to find it's going to work out because I'm going to do anything to make sure this works. So those people grow up and they become our high-ranking military officers. Not all of them, but enough of them, and the high CEOs and politicians that will do anything. They'll bully their colleagues and their peers to get what they want. And that starts young.
So what are the negative mental health consequences in the immediate and the long term? And here I think we are beginning to separate. There are those who are being bullied, and then there are the bullies themselves. And I think we need to look at both groups.
And there's actually three groups. There's a third group, and it's a bully victim, where in one area of their life, they're a victim. And in another area of their life, they're the bully. And that could be home and school. It could be like at the soccer field. They may be a bully, but at school, they'll be a victim. It depends on a lot of things, but particularly this group, the bully victims, tend to have more significant mental health consequences because they're having to go back and they can't, solidly become one or the other. The literature does show that if a person is consistently bullied, they tend to be less likely to have severe mental illness because they know what to expect. They're going to do everything they can to not be bullied, like avoid school. They have a lot of headaches. They have stomach aches, a lot of vomiting, and there's a lot of school avoidance. And just not having friends because it feels shameful, putting the friend at risk. And that's in one space, but in another space, they're doing the same thing. So right. It's sort of difficult.
Yeah, I'm thinking of people as you speak who, in a certain setting, they're finding ways and mechanisms to deal and manage and to absorb the hits that they're receiving. But then when they go home into their own space, it's almost like all of that aggression that they've absorbed needs a release, and they release it on people who they love and people who they don't perceive as a threat to them. So what do we do about that?
Well, I keep saying, I think it's getting better with the younger generation as we address it and do things, teach more person-centered interactions and continue to teach restorative justice types of behaviors. A restorative justice approach works very well to help the children work through the issues that provoked the bullying, and what were other better ways to manage that situation. I think if we continue it along the lifespan, we'll see that there's a lot of workplace bullying, and that's coming from bullying not being addressed in the population of people who are in the work world now.
And for listeners who may not be familiar with restorative justice, according to the U.S. Department of Justice, the commonly accepted definition of restorative justice used internationally is a process whereby parties with a stake in a specific offense resolve collectively how to deal with the aftermath of the offense and its implications for the future. Objectives of restorative justice are to attend to victims' needs, reintegrate offenders into the community, enable offenders to assume responsibility for their action, recreate a working community that supports victims and offender rehabilitation, and avoid escalation of legal justice and the associated costs and delays. When you look at the broader discourse in society today in America, and of course you hear everywhere that America is becoming a lot more polarized, and people are withdrawing into their communities, and that must at some point impact young people as well. And so is the research being done on that? How is that manifesting?
Well, it's manifesting as bullying because, if I go through all the groups of people who are outside of the reference group are definitely bullied. So I'll start with the Indigenous American. They are bullied probably more than any other group altogether.
Why is that?
Because they're bullied about their race, their rituals, their socioeconomic status, those types of things. Those are things that they are bullied about. And it's generally so bad that about 50% of students that start at kindergarten finish at 12th grade. So you lose 50% of the population. Yeah, and bullying was a significant reason for that. Asians are teased a lot, and so are Latinos are bullied a lot when they move outside of the traditional social space. So it's sort of like our society looks at Asians as very smart. They should be on the debate team. They should be doing all academic. If they try to play basketball or football, they tend to be bullied much more than any other group because it's not their place here. And with Latinos, it's similar too. They can do baseball and soccer, but when they move outside and want to be on the debate team or to be a basketball player, then they tend to be bullied over things like that. Yeah. And then the LGBT community, they're different. They're clearly bullied a lot, but they also retaliate more than any other group, particularly when it comes to cyberbullying. They do revenge bullying, but they are victims most of the time.
Were you bullied as a child?
I was bullied as a child. I was bullied. My mother would always pull my hair in a ponytail and it would hang down, and the little boys would yank my head back. Each grade I sort of tolerated it, but about, it was 6th or 7th grade, there were a couple of boys around and they put their hand up my dress, and then from then on I fought, and then I was never bullied again.
How do you think that experience impacted you moving forward?
Well, initially I didn't think it impacted me, but when I started doing the studies, I realized it did impact me, and I also realized that the bullying that occurs in workplace and universities, it just continues. People bully.
And have you applied the same kind of strategy or coping mechanism to deal with that kind of bullying as you
Yeah.
forward?
I realized if I stop them, it's almost like just stop and you can't do this with me. And I do that by sometimes, most of the times it's just having a conversation and being very firm. And it works. Bullies pick on people that are not going to do anything.
You have children?
Yes, I have children. I have 4 boys.
And was bullying ever something that they experienced?
Well, they didn't tell me until when I started working on it. They're like, the most common response to bullying is, it just happens. They are convinced at their ages and they're older adults that it doesn't affect them.
And you say?
That brought another question to my mind when I learned that, and that is, so why didn't it affect them? I'm wondering if the home environment is a protective factor. They were well wrapped in family love. And I'm wondering if perhaps because they knew they were not whatever people were saying to them, it didn't bother them, or whether most of us don't think about it until so much later. Unless you're a person who is severely affected by it.
Moving on to my next question, and something that you referred to earlier, this misdiagnosis of bullying and aggressive behavior. What exactly is that? If you could unpack that for us, and then why is that important, especially for mental health professionals who are working with young people who are negatively impacted by bullying?
So oftentimes, and then particularly with Black youth, they are considered just by nature naturally aggressive. So they are generally considered in most situations the aggressor, the bullier. And oftentimes they tend to be trying to fight back. But what I'm saying about the other is the diagnosis of depression, anxiety. Some of it is like irritability. So a child will be irritable, or for the anxiety, they'll be very quiet. But Black children tend to act out more when they have emotional turmoil. They tend to want to discharge it. And sometimes that discharging goes on to another student. My thought was, if we can get it up front, if during like a well child visit, or have a consistent way of assessing for our youth's mental health, that we can find out whether or not they have anxiety or depression, and then address it. And then I believe we can reduce bullying.
So this is a prevention. Has that been tried? If it has been tried, what have the results been like?
I am not aware that that has ever been tried.
It sounds like common sense, though. When you think about it, you talk about the social determinants of health, the social determinants of mental health, things that we carry with us from our backgrounds and our economic status, the neighborhoods we live in. All of those things not necessarily define, but definitely impact the way that you behave and the way you express yourself. So what would your advice be to schools and to the professionals, the social service people, the mental health people that young people will hopefully come across? How should they be responding to young people who are acting out aggressively, not necessarily out of malice?
Yes. So this is a big problem in schools, and particularly public schools, simply because of the numbers. You have a large class, you have one teacher, an event occurs where there's victimization and a bullier. And then to stop and do something at the moment is difficult. Oftentimes what should be done, I think, is immediately those two children, or whatever the number is of children, should be taken to the school counselor. Because counselors can be very effective in bringing things down. Nurses, if they're there, but nurses really are not involved that much in the school settings, unless there's it's physical bullying, direct bullying, and someone gets hurt. That person, and a nurse, could very well do some restorative justice, simply listening, having the students listen to one another, finding out what really happened, and then for each one to explain it to one another, and then resolve it. And that does happen fairly well, because each one has an idea in their head that the attention of the other was one thing, whereas in fact, once they talk to one another, they learn, no, that's not what was, they had misunderstood one another. And I think in terms of nurses, psychiatric mental health nurses, FNP, family nurse practitioner, pediatric nurse practitioners should actually ask questions about bullying, but use different language for the child, because children don't want to accept that they're being bullied. And sometimes they'll say, yes, I'm being bullied. But a better way is ask, well, how safe do you feel at school? Is your school a safe place? And if they say yes or no, sometimes, well, what makes it sometimes? And then ask them that. And finding out, how many times have you seen people get pushed or shoved in your school? And that may open a door for them to say, it happens a lot. In fact, I get pushed and shoved a lot. And then you find out that they're being bullied at school. And from there, the parents should be involved. And then you go to the school, because schools do have a responsibility to keep the children safe while they're at school.
There's a sentiment that I'm picking up from our discussion, which kind of surprised me. And this is, and tell me if I'm wrong, but maybe a sense of empathy for those who are actually doing the bullying. Normally, if somebody's a bully, automatically you'd want them to be punished, or you want their parents to step in and do something. But from what you're telling me, that might not be the best thing. So what should be done with a bully?
A bully should have to face their victim. What my experience has been over the years, that when two people are brought in together and they start talking, both of them have completely different ideas about what someone said, what someone did, or how they felt. And youth now are able to say pretty easily, because the language is out in the community, that I wasn't feeling myself, or I was down today, or I was anxious today. And they'll say that, and then they just really are open. Younger people are open to be able to talk about these feelings and then reconcile much easier than adults.
Even if it's been something that has continued over a period of time, like even if it's not just a one-off, if there's been this relationship of bullying between two young people over the course of, several years.
Right.
Do you think that kind of thing still works?
Well, it has worked. For me, it has worked. Students who started in second grade bullying, having this bully experience, and then by fourth or fifth grade, they're tired of it, or I'm just coming in and saying, we need to do something about this, and I bring them in with the counselor and have them talk. It has worked.
Could you give me an example, a scenario like that you've experienced with adolescents or older where this kind of intervention has worked?
There was an incident not that long ago where two students were fighting, and the school wanted to not expel, but suspend them for a certain amount of time. This is in the area of a very under-resourced area. And so having them children out of school, for me, is just absurd to me. So I went to the director and asked, could I talk with them? Can they give me a chance to just sort of do it? I called it a mediation.
How did you hear about it?
Well, one of the students was my student, was a person I was seeing.
I see.
Yeah, and that's how I heard about it. And like go to the class, and then the teacher says, well, they're in the office. They were fighting or something, and so I went down to the office and did that and got them. They were resistant initially, and it may be because of my age and stuff that they were, less likely to be completely resistant. But they came up to the office and we sat down. And of course, there's the silence. They're adolescents. They don't have anything to say at first. And I said, I'm good with silence. So we all just sat in silence. And then one of them started talking. And they explained that they thought one thing and the other one thought another thing. And they were retaliating against something that really wasn't the case. And I think, information gets lost. And people discharge out and just get angry because that's the way things seem to be.
And then what was the result of that discussion?
It was resolved. And actually, they both joined a group from the students that I had. They've been fine. They're not fighting anymore. They really understood. What was very impressive was how they express themselves and saying, I didn't know that's what was going on. They really opened up, and we're happy that they were able to understand it better. I'm hoping that carries over to other parts of their lives, that they remember this.
Typically, when and in what circumstances do psychiatric mental health nurses encounter bullying?
So, Indrias, it depends on where they're working. So psychiatric nurse practitioners may encounter patients who have been bullied, and they're adults. So if they're adult mental health practitioners, then they'll see it there. If they're pediatric, that's when it will come up in those settings. And then they address it differently. But the idea is always for us to do better with one another. That is a good thing to do, the restorative justice, where there's another person, an objective person in the room where you talk about and get things cleared up. because it is stressful for people to be a bully and it is stressful to be a victim.
And in your estimation, the way that nurses, psychiatric mental health nurses, or other behavioral health professionals, the way that they are typically being trained, do you think that they have what it needs to recognize and to respond effectively to bullying, both in the preventative aspects, as we discussed, and also dealing with the consequences of somebody who's been bullied?
Well, I don't think they're trained, but I do think that there is discussion about symptoms of bullying, so symptoms of anxiety and depression, and how they are associated with being a bully or a victim. And so if a provider is being thoughtful about what they are trying to find in terms of the whole person, we have to know that in most circumstances, there's a potential for us to be bullied, and so that should always be in the back of our minds when we're working with someone about their safety. And that's a good way to introduce it as feeling safe. What is it like to feel safe or unsafe, and then take it from there. So psychiatric nurse practitioners and family nurse practitioners and pediatric nurse practitioners, it should be something that's held in the back of our minds, that is always a possibility that a person is being bullied.
You've been doing this research for quite some time. And what more do you think needs to be done, both for the preventative part and then dealing with the impact of bullying? What more information do we need?
I think prevention is the biggest. It's being able to link the two together as there's one can precede the other, one can be a consequence of the other. And then the other part is to recognize the impact, the mental health impact that it has on everyone, because everyone that's involved in that experience, they do experience mental health symptoms very long into their lives. Youth and young adults who are bullied through school and up to college, and then they get a job where they're bullied. So then that's how they define themselves. And then it's a very depressing or anxious self-perception. So being very aware that this causes significant mental illness that continues later on. It's been written that children who are bullied have significantly more difficult mental health outcomes than children who have bipolar disorder as children. And so it was pretty significant to read that. And the belief still is that even if we don't use bipolar, that they have significantly more anxiety and depression later on in life that's just hard to get over.
And I'm just imagining how this can play out. We've been talking about it playing out in the corporate world or in the military, but in just everyday life, some of the really jarring statistics that you hear, health-related statistics in this country, one of them is, of course, the maternal health, maternal mortality, particularly in communities of color, in African-American communities. There are people who've researched the behavioral health components, what is contributing to this high rate of maternal mortality. And part of it, and this I learned from the podcast episode we had with Dr. Phyllis Sharps, was intimate partner violence, where you have partners beating up their pregnant wives or partners. And then you have, as a coping mechanism, people going to substance abuse. The chain reaction can be quite dramatic. So are we paying enough attention to this? And then what more can nurses do? Like, how can nurses be better positioned to deal with this?
I think it can be agreed that intimate partner violence is just an extension of bullying, because there's a difference in power, particularly when a woman is pregnant. So your question was, what can we do as nurses? We can teach. We can teach our patients and we can teach our students about these phenomena for the purpose of helping to empower them. I think we're at the beginning, the early stages of this. There does need to be a lot of teaching of nurse practitioners and people in the mental health field to really understand that what they're seeing is an extension, if it's intimate partner violence, if it's suicidal thoughts. If you talk to a person who has anger issues, they've been either a victim or a bully when they were young, a large percentage of them. So either in the home or in school, someplace where it wasn't safe and they were victimized, or they victimized other people. I think it could easily be incorporated into like a diagnostic class or any type of clinical class, where when you're doing your clinical assessment, when we're doing our diagnostic assessment, part of it is to ask the questions about being a bully or being victimized, and then go from their answer. If we consistently were able to do that, if we were consistently put our foot down and said, this is when I'm asking a person about symptoms of anxiety, depression, bipolar disorder, or even schizophrenia, that you ask the bullying questions like, have you been hit, shoved? Were you hit and shoved when you were a child? And that is even an extension of the ACEs, because we're asking questions about violence as children that are directly related to bullying.
You are listening to Mental Health Trailblazers Psychiatric Nurses Speak Up, brought to you by the SAMHSA Minority Fellowship Program at the American Nurses Association. The stigma about mental health or substance abuse issues is particularly prevalent in underrepresented racial and ethnic groups. One way to overcome that stigma is to recruit more nurses from all underrepresented communities into these fields, so that they can focus on eliminating stigma about mental illness and substance use through their leadership in research, practice, education, and policy development. Receiving treatment from someone with a similar background builds trust that can lead to better outcomes. The SAMHSA Minority Fellowship Program at the American Nurses Association is actively engaged in identifying and supporting nursing students seeking graduate degrees in psychiatric mental health nursing. Visit emfb.org to learn more. Welcome back, Dr. Combs. Turning now to your professional journey, tell me how you got into the field of nursing.
I didn't initially want to be a nurse, but my mother was a nurse, and I noticed that she had a lot of flexibility in her schedule. She was there when we left, and she was there when we came home from school, but I didn't realize it was torturous because she was working nights. As a child, it looked good on the outside. And so once I got married and started having children, I decided to return to school and become a nurse. The nursing school, our last rotation was psych, and I went on the psych unit, and I loved it. The nurses were very smart. They actually ran the unit, and I thought it was kind of profound to me that you had to use your brain and not all these, I call them weapons of medicine, and you didn't have those weapons, so you really had to think through things. And so that's when I decided I wanted to be a psych nurse.
And you continued. You went on beyond just practicing. You decided to do your PhD. What was the impetus for continuing?
Right. So I always thought I wanted one once I understood it, but initially I didn't understand what a PhD was, because when I was young, the terminal degree was a master's for nursing. And I wanted to get a master's. But after I got the master's and I was working, teaching, and I was putting together a really amazing program, they were taken from me and given to a person with a PhD. So I realized that I needed to have a voice, a real voice. I needed to have a doctorate. And that's what did it.
How fulfilling is this work?
It's very fulfilling for me. Yeah, it's very fulfilling. I believe that there's an easing of pain, internal pain and stress for the people that I work with.
Well, thank you very much, Dr. Combs. It's been a pleasure speaking with you today. Thank you for sharing all of your knowledge.
Okay, take care.
And that does it for this episode of Mental Health Trailblazers, Psychiatric Nurses Speak Up. I hope you've enjoyed our discussion, and I look forward to you joining us on future episodes. This is the Minority Fellowship Program at the American Nurses Association podcast, featuring nurse scientists addressing the psychiatric and mental health issues affecting underrepresented communities across America. You can always find us online at emfp.org and wherever you get your favorite podcasts. The views expressed by the speakers and host do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government.